Okay, I'm sorry. The video cut off. The time ran out. But in my respiratory assessment, I meant to add when you are assessing your patient, um, you want to ask them questions like what is your health history? What medications are you taking? What is your family history? Excuse me. Where do you live? Do you have any allergies? Um, do you smoke? And if they do smoke, then you can always calculate the smoked, the pack years smoked. Um, you want to ask about recreational drug use and alcohol. Um, just make sure you ask about stuff like that too. Now I'm going to demonstrate how to do trach care. Um, you would always want to uh, assess the need for suctioning on your patient. You want to make sure that um, your patient is in semi-Fowler position. Um, Explain to the patient what you're going to do. Wash your hands. Then you would want to go ahead and hyperoxygenate with your ambu bag 1 to 3 minutes before. Um, you can go ahead and you'll need hydrogen peroxide and saline, so you'll always want to go ahead and get your bottles ready for that. Go ahead and loosen them up. You would have them out right here. Um, then you would want to go ahead and open up your trach kit. And your patient would have a clean sheet, drape, or something over them at the time. You can go ahead and take your sterile gloves out, put them to the side. Go ahead and take your sterile drape out. Okay. You would want to go ahead and lay your sterile drape down. And I'm sorry, you would already have your clean gloves on at this time. Um, then you would want to go ahead and drop your supplies on your sterile fill. Um, you would want to go ahead and pour your saline and hydrogen peroxide at this time. Never, cross over your sterile field or turn your back to it or anything. So, say this is your bottle of hydrogen peroxide. You would want to pour that into the largest part of your tray. Half hydrogen peroxide and half saline in that tray. And then you would want to get your saline bottle, and in the other two openings, you would want to pour sterile saline in those. Put the caps back on and set them to the side. And then you would want to go ahead and you would want to go ahead and take the old dressing off. At this time, toss it to the side, and then at this time, you are ready to do the trach care, and you want to apply your sterile gloves at this time. Oh, before that, I'm sorry, I need to back up a little bit. Before you put your sterile gloves on, while you still have your clean gloves on, when you take that old dressing off, you want to go ahead and unlock, take the inner cannula of the trach out, and you kind of twist and it unlocks and pull that out. And with take that inner cannula and put it in the biggest tray with the hydrogen peroxide and the saline mixed, and let it soak in there. And then that's when you're going to go ahead and apply your sterile gloves. Go under this one, pick it up. Okay. Scoot that to the side. Okay, and now we're ready. We're going to go ahead and just separate our supplies here on our sterile field. You got the split gauze and 2 4x4s, your collar, your brush to clean, and your cotton tip applicators, Q-tips. Okay, and then you're going to go ahead and get that inner cannula out and clean it. Pick it up by the lock part and clean inside of it real good. Discard that, and then put it in saline and let it soak. Then you want to take one of your 4x4s, dip it in the other part of the saline, and clean the around the stoma. Just do one side, one swipe down, fold, and do another swipe. Discard. Then you can take another one, a dry one, and dry it off on the same side. Discard. And then you would want to take your Q-tips and dip it in the same tray, the normal saline that you dip the 4x4s in, and you would want to clean under the faceplate, which would be around the stoma area. And then you would want to change the collar, trach collar of the patient, but you would always want to leave the old one in place as you're doing this. So you would just want to take one hand and stabilize it, and it's usually Velcro, and just unvelcro. Or no, you don't want to unvelcro yet. You just want to hold it in place. Get your new one, and it goes around the neck. And usually, like I said, it velcros on the sides. You want to make sure it's secure, in place, and then you can remove the old one. And then you would want to go ahead and put your 4x4 underneath.